Hello and welcome. You're watching Health and Wellness, Save a Life. I'm Gargi Rawat. Now imagine that someone suddenly collapses in front of you after a cardiac arrest and you can't do a thing. It's not a scene from a movie but a scenario which is getting very common. Even young adults are suffering from sudden cardiac arrest due to a sedentary and stressful lifestyle, and without immediate recognition and CPR delivery, the chance of survival decreases significantly as each minute without life-saving interventions passes. It has been proven that bystander CPR improves the rate of survival by almost 50%. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who can help you understand sudden cardiac death as well as the role of CPR to revive and save a life. Thank you so much, doctors, for joining us. We're joined by Dr. Ankur Phatarpekar, Director, Cath Lab Symbiosis Specialty Hospital, Mumbai. Dr. Priya Palimkar, Interventional Cardiologist, Sahyadri Hospital, Nagar Road, Pune. And Dr. Soumitra Kumar, Professor and HOD, Cardiology, Vivekanand Institute of Medical Sciences, Kolkata. Thank you so much for joining us and talking about this issue around which there needs to be a lot more awareness in the country. Now, Dr. Ankur, I'd like to start with you. What is a coronary artery disease, and can coronary artery disease lead to sudden cardiac arrest?
Hi Gargi, thank you for having me here. And let's first understand what coronary arteries are. So basically, heart also requires blood supply. So the arteries supplying the heart are called as coronary arteries. Any buildup of cholesterol in these arteries leads to narrowing of the lumen of these arteries. So there might be two presentations how this buildup might show up. First is a slow buildup from say a 20, 30, 40, 50% going on to 90%. Might present with a very stable presentation. That means the patient might get chest pain while walking for 5 minutes. The other presentation is maybe the blockages are not significant. Maybe it's a 40-50% block. But suddenly, because of the buildup of the cholesterol, there is rupture of this plaque. And when it ruptures, it takes a clot along with it. So say a 40-50% block becomes a 100% block because of the clot, say in 5 minutes. 5 minutes back, the patient was absolutely normal, and suddenly he gets this chest pain. And because of the 100% blockage happening there, the blood supply to the heart goes down, and because of that, the patient gets a heart attack. There are two consequences of this heart attack. One, as you know, the heart is a pump, and heart and lungs are connected. So what happens? The heart does not pump the blood out, and because of this, all the blood dams back in your lungs, and the patient starts feeling breathless. This is called as heart failure. The other presentation is devastating, and it's called as cardiac arrest. What essentially happens in a cardiac arrest is because of this 100% block, there are bad rhythms which are happening in the heart. That means the heart rate might go very fast, giving rise to ventricular tachycardia or ventricular fibrillation, or go very slow, which is called as complete heart block. And this leads to stoppage of the working of the heart, and this is called as cardiac arrest.
All right, Dr. Palimkar, during cardiac arrest, what actually happens to a person? What is cardiac arrest?
So, cardiac arrest is the sudden, unexpected cessation or stoppage of the heart function. And along with that, the respiration also stops and the patient suddenly becomes unresponsive and unconscious. So this is a problem related to the electrical conduction of the heart. So like Doctor just explained that the heart has a blood supply system with the coronary arteries. Similarly, there is a conduction system which is giving the electrical impulse to the heart and maintaining the rhythm or the contractility or the beats of the heart. And this gets disturbed in a cardiac arrest. So either it would be too fast, which he said is ventricular tachycardia or fibrillation. When the heart is beating so fast, it doesn't have any effective contraction, and so there is no blood pressure, and suddenly the heart can stop. Also, when the heartbeats become extremely slow, the heart suddenly stops beating. And at this time, the heart suddenly ceases to beat, the respiration stops, and the patient also becomes unconscious. So this is a big issue because during this time, the heart pumps blood to the entire body and the most sensitive is the brain. So when the brain does not get any blood supply, the brain ceases to function. Within 4 minutes of lack of blood supply, the patient can become brain dead. And if the blood supply is not restored, within 8 minutes, the patient can die. So the whole purpose of doing the CPR is to ensure that the blood is continuously pumped to the entire body till a rhythm is established.
All right, Dr. Kumar, if you can also further elaborate how you can help someone experiencing a heart attack or sudden cardiac arrest.
Yeah, heart attack and sudden cardiac arrest, these two terminologies should be identified separately. Heart attack is the common cause, if not the most common cause of a cardiac arrest, but heart attack is a separate disease entity. Here the patient presents with a severe chest pain, often associated with a feeling of shortness of breath, sweating, feeling of nausea, vomiting, etc. And here it occurs because of a total blockage of a coronary artery where the blood supply to a part of the cardiac muscle is jeopardized. So if this kind of discomfort lasts for more than 15 to 20 minutes, the patient should immediately rush to a nearest hospital where reperfusion therapy, either with thrombolytic drugs or with primary angioplasty, is available. The sooner the patient reaches it better. The first hour is called the golden hour, and incidentally, most of the cardiac arrests that occur secondary to heart attacks also occur within the first hour. So from both points of view, it is extremely important that after a heart attack, patient is rushed to a nearest hospital. In case of a cardiac arrest, which has been described by my previous speaker, there is hardly any second that can be lost. So the sooner we initiate CPR, the better, because we should remember that with every passing minute, the mortality increases by about 10%. On the reverse, if we initiate CPR in a timely fashion, as soon as the patient is identified to have a cardiac arrest, the mortality can be decreased at least by 50%. And CPR can increase survival by 2 to 3 times. So timely CPR in case of cardiac arrest with or without heart attack is extremely important.
Right. Now, Dr. Ankur, lack of CPR awareness is a big health challenge in India. Can you please explain the need and role of CPR in saving a life of a person who suffered a cardiac arrest, and how we need more people to be trained with this?
So Gargi, let me tell you, it's a very basic life support skill. Just like how you would survive if you know swimming. In the same way, giving a good CPR helps save a life. So that's the first thing. Second, CPR term is very self-explanatory. It's cardiac pulmonary resuscitation. So that means the heart and the lungs are resuscitated or restarted when the patient has a cardiac arrest. A good quality bystander CPR saves lives. To give you some statistics, almost 3 lakh cardiac arrests happen all over the country, and out of which around 70% happen in the homes, 20% happens in public places, and 10% around in the hospitals. So you can see the need for CPR in amongst the general population. Going further, 40% of people who would have been dead survive if they are given a good quality CPR. Imagine the benefit which it would give to the general population. Also, the other thing with CPR is also the presence of AEDs. AED present, if it's present, it helps give shock and revert the bad rhythms to a normal rhythm of the heart. So that is also very important. Now, coming about awareness and how to go about, I think it should be taught in schools. We are taught a lot of things in schools, but something as important as CPR is still away from from being taught in the schools. So CPR should be taught in the schools, and not only that, but also how to give a CPR should be reinforced at fixed intervals of time. That means people who have learned CPR might forget it because they are not doing it regularly. So reinforcement of CPR skills is also very, very important.
All right, now, so we've spoken about the importance of CPR, but Dr. Palimkar, as doctors, you know how to perform it. How would a non-medical person know if he or she is doing CPR correctly, and what results from CPR what should they expect, and in how much time?
So, firstly, the person should ensure that the patient is really in cardiac arrest. check the pulse, see whether the patient is breathing, is the chest going up and down, and shake the patient and see whether the patient is really responsive or not. And once you know that the patient is really in cardiac arrest, you first thing you do is call for help, because you need two people to help for this procedure. One person can call for an ambulance immediately while the other one takes the patient on the floor. You need to have a firm support down and start the chest excursions. So chest excursions are to be done with both the hands on the lower part of the sternal, the middle bone of the chest, and you should do it at the rate of 100 per minute. So after every 30 chest compressions, there should be one mouth-to-mouth respiration where the person's head is tilted back, the nose is closed, like the nostrils are pinched, and then you put the mouth on the patient's mouth so that there is an airway seal, and then give a deep breath into the patient. So every 2 breaths after 30 compressions, and see whether the chest is lifting up with your breathing into the patient. But nowadays, because of COVID and all, sometimes you may not be comfortable. So there is something called as hands-on CPR also, where you don't give the mouth-to-mouth respiration, but just do the chest compressions. So, with that, you ensure that the blood is continuously moving from the heart to the other organs. And of course, look for an AED, like what he said. All malls and shopping centers, airports, big public places usually will have an AED, which is called as an automatic external defibrillator. So, you can give a shock with this, and you can restore the rhythm of the heart for the patient. And you continuously do the CPR for at least 15-20 minutes. If the patient survives, if the rhythm comes back in 15-20 minutes, then the patient has a very high chance of survival. But if not, you still continue to do for at least 30 to 45 minutes, till help arrives, and till you're able to shock the patient or, restore the airway by, putting it in a tube into the respiratory passage.
All right. So you spoke about, non-medical people performing a CPR. Dr. Kumar, what happens if CPR is not done properly? Can only trained people perform CPR, and, what can the sort of drawbacks be?
Yeah, of course, CPR by a trained personnel has the best outcome, needless to say. But then something is better than nothing. Even if a person is not trained with CPR, and he is the only person around, if he starts any kind of chest compression, at least that will give the victim a chance to survive. So no CPR is the worst, or has the worst outcome. Untrained CPR would be somewhat better, and of course trained CPR will always have the best outcome with support from AED if it is available in the vicinity. So there are graded recoveries with the kind of CPR that is executed, and of course with support from AED, the chances are the best. And the patient should be rushed to the nearest hospital whenever the ambulance is available. So these are the sequences that should be followed in case of cardiac arrest.
All right, with that, we'll slip into a short break, but return with more questions for the doctors. Stay with us. Welcome back. You're watching Health and Wellness Save a Life, and we're talking about CPR and the importance of recognizing heart disease. Let's go across to the doctors with more questions. And Dr. Ankur, what if a person with an ICD or a pacemaker gets a cardiac arrest? Then can we perform CPR on such patients?
A very good question, because a lot of patients have pacemakers, and this is always a question which their relatives would ask, is whether can we perform a CPR or with an ID also. What is essentially a pacemaker and ID? Let me explain to you. A pacemaker is a device to increase the slow heart rate of the heart. So people who have slow heart rates, it is a device to improve it. The AICD is basically a device which shocks these fast heart rates and gets it to the normal rhythm. Now, what happens with the patient with the pacemaker? It is simple. You do it like a regular CPR. The same thing which Dr. Palimkar told you is the same thing you do. But what happens with the patient with IED is sometimes because the patient goes into cardiac arrest, the machine might be charging and giving shocks internally. So it's very important that you recognize when the patient's body is moving, that is the time when he's receiving the shocks. So if you're doing CPR in such a patient, it is better that you wear gloves yourself and also shoes down below and continue in the same way once the shock is delivered by the machine. Now, when it comes to using AEDs, it is important that we stay away from the pacemaker and the AICD side. So it should be at a sufficient distance below where you attach the AED pads. So these are important things when you have a pacemaker and an AICD in place in patients.
Right. Dr. Priya, if you can tell us what precautions should existing heart patients take while traveling, especially when they're flying?
So if you are flying, you need to take permission of your doctor to see whether you are fit to fly, and preferably have a case capsule, meaning a summary of your medical ailment. And if you are traveling long distance or to another country, do your ECG, echo, and if required, stress test also prior to traveling. Take an aisle seat so that in case of an emergency, you can be easily moved out of the seating areas. Keep yourself well hydrated, avoid alcohol and caffeine, excess of caffeine. And of course, you need to also get up periodically and take short walks to prevent deep vein thrombosis in the legs. And make sure you're vaccinated. Anyways, nowadays, COVID vaccine is mandatory, but also you need to take other vaccines like typhoid and hepatitis. And, just most importantly, stay hydrated and keep walking in between. And you just carry your medical history, and if you have an ICD or a pacemaker, just carry that card as well with you.
All right. And Dr. Kumar, we've been talking about the high incidence of heart disease in India as well. And how important is it for patient caregivers and family members who have a member suffering from heart disease to then learn CPR?
Extremely important. If we remember that almost 80 to 85% of cardiac arrests happen outside the hospital premises. So that means that they can occur in the patient homes as well. So if we have a patient diagnosed with a significant or severe heart disease who is likely to have a cardiac arrest at any point in his life, it is vitally important that the caregivers, either the professional caregivers or even the patient's relations who stay live with the patient, it is extremely important that they get trained with proper CPR techniques, and they should have ambulance number which is in the nearest location to be of service whenever such emergencies arise. So CPR should be instituted by the caregiver or the patient's relation, whoever is immediately available and diagnoses the cardiac arrest, and then gets in and asks someone to call an ambulance so that till such time that expert medical help or paramedic help arrives, the patient can be somehow kept alive. So it is extremely important that caregivers and patients' relatives get acquainted and trained with the art of CPR.
All right. Dr. Ankur, if you could tell us now about cholesterol. Is there a link between dietary cholesterol and heart disease?
So cholesterol is very important part in the pathophysiology of heart diseases. So diet definitely plays a role, but it's not the complete story. So many a times patients who are diabetics or patients who have familial tendencies of having high cholesterol, they might have inherent tendencies to have more cholesterol in their body. So just a dietary modification might not sometimes help in these individuals. So you have to go beyond diet. So it's exercise, diet, and sometimes you might have to take medications. And also it's very important to know that whenever you do your cholesterol reports, any reference range which is seen, it's for the general population. So diabetics and patients who have cardiac issues, the cholesterol has to be kept much, much lower than what it is. So it is very important that we don't get this inertia, or what is called as therapeutic inertia, wherein we just maintain our cholesterol, try to maintain our cholesterol by doing just a dietary change, but not bringing it down to levels which are actually needed and recommended.
Right. And Dr. Priya, if you could tell us, is there a relationship between heart disease and diabetes?
So, diabetes is the mother of many diseases, and heart disease is the most important. All diabetic persons, they have a 2 to 4 times higher chance of having a heart problem. And the longer the duration of diabetes, the more the chances of having a heart attack, because diabetes affects the arteries of the entire body. It increases the process of atherosclerosis in the arteries, which is the formation of blockages, more so in the heart or all the other arteries as well. And so it also affects the nerves of the body. So the nerves which control some of the functions of the heart, those are also affected by diabetes. So yes, all patients who have diabetes, you have an increased chance of having heart attacks and strokes. Right. And you should be always on the preventive side for it.
All right, important issues to keep in mind. Well, thank you so much, doctors, for joining us on the program and creating awareness about this, and especially telling people how they can save a life. Thank you all for watching at home. Goodbye.